I have to say, everyone, I tried to find a instant recess pre-recorded video for this event, and didn't work out too good, Diane. I almost stole the Henry Ford one.
Oh,
We'll just have to do
okay.
It just weren't the right length. Everything was, yeah,
Too long.
yeah. I'll keep looking. I'll do it today, though. Good morning, everyone. All right. We're excited to have you, Kim. All right. All right, so while people are logging in, I can share my screen and we can get started. Just have to find you guys now. All right, I guess we'll go ahead and get the meeting started. Good morning, everyone, and thank you for joining us on this Tuesday morning. This is the Motion Coalition meeting, member meeting, and we're all here. So I'll give some time. I'll introduce our co-chairs for our coalition. We're very fortunate to have two wonderful co-chairs. Dr. William Dietz is George Washington University Director of the Sumner Redstone Public, I'm sorry, I'm not even going to try it, Dr. Dietz, Public Health Institute. Ms. Diane Vlad is our co-chair from Henry Ford Health System, and she works in policy management. So welcome.
Thank you. Welcome, everybody. We're having a beautiful day here in Michigan. No storms in the picture.
Okay, so we'll go ahead and get started with our reflection, if I can find my. So the reflection this morning is going to be given by our somewhat newly appointed Chief of Staff, Brandy Legodinsky. I can't say it.
You almost had it, Carolyn. Thank you. And good morning, everyone. This quote that I found, I thought it was very appropriate. It's from Orison Swett Martin, and it says, "Don't wait for extraordinary opportunities. Seize common occasions and make them great." So I thought that was appropriate, and it helps us, push us to move forward and make every occasion a great one. Thank you.
Thank you.
Thanks, Brandy. That was great. Okay, I think, oh, good morning, Tiana. I just saw your face. I think everyone's going to join. So I think our first presenter today for our meeting will be Dr. Bill Dietz, our co-chair extraordinaire. So he'll be presenting on the impact of COVID-19. Dr. Dietz, I can progress your slides for you if that's okay.
Yes, that would be great. Thank you.
Okay.
So first slide. Well, so thanks and welcome everybody. So I'm the chair of the Sumner Redstone Global Center for Prevention and Wellness at George Washington University, which is in DC. And I want to talk this morning about the impact of COVID-19 on pediatric health, but more specifically, I think we need to recognize that COVID-19, obesity, and food insecurity are a syndemic. Next slide, please. The definition of a syndemic is clusters of diseases, or in this case, with respect to food insecurity or conditions. So clusters of diseases or conditions within a population, and that these have an adverse promoting effect on each other in a negative way at both biological and biosocial levels. And I think you'll see that the kinds of consequences of this endemic are exactly that. And another characteristic is that there are these large-scale social forces that precipitate diseases clustering in the first place. And as we'll see, often with a disparate impact on marginalized populations. So the next slide shows some of those interactions. So you see here that these are bi-directional. So COVID-19 affects food insecurity, which increases obesity, which increases susceptibility to COVID-19 infections. It's also, the bottom arrow really should be bidirectional, but we know that food insecurity is greatest among people with obesity, particularly women. And the interactions are shown here on the right side of the slide. So there's a increased risk of COVID hospitalizations and death in people with obesity and in Black, Indigenous, and people of color. In these populations, we know there's not just an increase in hospitalization, but it's an increased severity of infections. The inactivity that's been associated with the lockdown from COVID-19 increases obesity. And in turn, as you'll see in a few minutes, inactivity also increases obesity, hospitalizations, and admissions of and death with COVID-19. So another interaction. There's increased food insecurity secondary to supply chain failures. So for example, there's a shortage in beef production because of so much COVID infections in and processing plants. So that, for example, in Nebraska, at one point there was a 30% frequency of positive COVID tests, and people were still coming to work with COVID because they couldn't afford not to come to work. And those supply chain failures have increased food prices and also increased reliance on ultra-processed foods, which we'll see in a minute. But the joblessness that occurred as a result of the lockdowns and the failure of businesses also reduced purchasing power as a consequence. So all of these factors contribute to food insecurity, which in turn contribute to obesity, which in turn contribute to an increased risk of COVID-19 infections. For poor populations, many of which are people of color, increased ultra-processed foods and poor food quality and low food intake, which are consequences of food insecurity, may increase susceptibility to COVID-19. They certainly, as I mentioned before, act through the obesity factor to increase susceptibility to COVID-19. Next slide, please. So I think we're all aware of just how rapidly food insecurity increased. These are data, these are the latest data that are representative that I could find, even though they're from May 6th. And you can see that food insecurity was pretty constant, unacceptably high, but pretty constant up until 2018. And then there was a gap in the federal measurements of food insecurity, but an abrupt increase coincident with the COVID-19 pandemic. And you can see that mothers with kids 12 and under have the highest rates of food insecurity, 42%. And right below those are households with children under the age of 18. So food insecurity became rampant, and the definition I've included here at the bottom. Children in my household are not eating enough because we couldn't find enough food is the yellow bar. But the food that we bought just didn't last, and we didn't have enough money to get more. So this all increased reliance on ultra-processed foods, which are those that are most readily available in low-income communities through corner stores, and also reliance on emergency food programs. The SNAP benefits and the increase in the SNAP benefits did a lot to begin to mitigate this, but I think we're still seeing this, and perhaps there we'll have some updated data from Detroit in a few minutes. So the next slide. This is an important study and one of the largest of its kind, which looked at the frequency of repeated cross-sectional frequency of obesity in cross-sectional studies before the pandemic. And you can see on the bottom of the slide, between 2019 and January 2020, things were pretty stable. And there were, as you can see, significant differences in the prevalence of obesity among between non-Hispanic whites, which are the lower green bar, and Hispanic and non-Hispanic Black populations. So then we had the pandemic beginning in January 2020, and repeat measurements, not necessarily of the same kids, but another cross-sectional study was done between June 2020 and December 2020. The mean age of the kids in the study were 9 years, and overall, the prevalence increased from 13.7% to 15.4%. And you can see that there were already, even preceding the pandemic, there were marked differences in the prevalence of obesity between Hispanic and non-Hispanic Black patients, or in this case, patients, and non-Hispanic white patients. But during the pandemic, as shown on the right, the prevalence in non-Hispanic, the differences in prevalence, and I'm sorry, I didn't make that clear in this slide, but the differences in prevalence between non-Hispanic Black and Hispanics and non-Hispanic whites increased from 10 to 11% pre-pandemic, and to 13 to 14% differences in prevalence during the pandemic. And you can see that on the right-hand part of this slide, that the increases occurred in in all three populations, but there was a greater increase in the prevalence of obesity among Hispanic and non-Hispanic Black children, probably attributable to the factors that I showed before: inactivity, reliance on ultra-processed foods, food insecurity, and so forth. The other point that needs to be made is that physical activity, or more appropriately, physical inactivity, plays an important role in COVID-19 infections. This has not been widely publicized, but I think it's clear, as shown in the next slide, that this is something we need to worry about. So these are data from Kaiser Permanente of 448,000 patients with COVID-19 infections. So these are all people who had infections. And Kaiser Permanente is unique in that they have physical activity as a vital sign. So this population that was studied had their physical activity levels recorded 3 times in their electronic health records between March of 2018 to March of 2020. And during this period, you can see that, and again, these are all patients with COVID-19, that people who were inactive had a 10% risk of hospitalization, a 3% risk of a trip to the ICU, and a 2.5% risk of death. Those that had some activity had a somewhat lower impact of hospitalization, ICU, and death. But notice that those who met the physical activity guidelines had only a 3% risk of hospitalization, a 1% risk of a trip to the ICU, and a 0.4% mortality. So a 6-fold difference in mortality between people who were inactive and people who met the physical activity guidelines. And the final slide shows some of these underlying factors, which are really social determinants associated with the COVID-19 infection. So you can see at the top that obesity and ethnicity contribute to the severity of COVID-19 outcomes, as well as hospitalization. In addition, these chronic diseases like diabetes, cardiovascular disease, hypertension, pulmonary disease, all contribute to severe COVID-19 infections. And obesity and race ethnicity, in turn, are major contributors to these same chronic diseases. So there's kind of a double whammy exposure of COVID-19 associated with poverty and race. And I think it's clear that these are attributable to the social determinants of health in these populations, some of which is structural racism, the absence of high quality, relatively inexpensive foods in Black neighborhoods. And I think I've mentioned before, in DC, there are 3 grocery stores that serve 150,000 people in the predominantly African-American districts of Columbia. Whereas in others, there are about, the ratio is about 24 to 60,000 people, a real impact of structural racism and redlining of the Black communities. These have led to inequitable food access and reliance on ultra-processed foods, as we've mentioned. In addition, these populations have inequitable access to healthcare, and a contributor to the COVID-19 infections are overcrowded housing and poor working conditions. And as I mentioned before, those working conditions among the essential workforce in the food procurement area have contributed to the extensive increase in COVID-19 infections in the workforce. So just to summarize, these three areas, the area of COVID-19 infection, obesity, and food insecurity are a syndemic. They interact in time and place. They have a negative effect on each other. And as this slide shows, they're determined by social factors, many of which are related to structural racism and the inequities in our population. So thanks. I hope I left 3 minutes or so for questions if anybody has any. All right, well, thanks very much.
Thank you, Dr. Dietz. So this was our overview of the syndemic. Our next presentation is going to be perspective from the state, and Ms. Lonias Gilmore is going to be presenting. Lonias, if you don't mind introducing yourself, I would greatly appreciate that.
Sure, thank you. Good morning. My name is Lonias Gilmore, and I am charged by the Michigan Department of Health and Human Services with protecting and promoting nutrition and physical activity for Michigan's children. And that roughly starts with the prenatal period and protecting breastfeeding and protecting birth and breastfeeding as well, and goes all the way through adolescence. And of course, there's overlap there. And I'm also honored to serve on the Motion Coalition Steering Committee. So thank you for inviting me this morning. And I have actually been invited to kind of provide state perspective on the syndemic that Dr. Dietz just gave us an overview of. And I apologize, my screen is doing things. Pardon me. And I hope that I can provide some additional context and inspiration for our conversation coming up a little later around what we might think about in terms of advocacy opportunities. I'm also going to talk through some COVID-19 innovations and also some things that states like Michigan have been able to take advantage of that might point to some future innovations or some ideas around how we might continue to improve food access and solve food security, frankly. So I hope that I can bring that perspective to you this morning. Next slide. So I wanted to first kind of talk about just general food assistance benefits. This is referring to SNAP benefits, formerly known as food stamps, of course. And during the COVID-19 pandemic, for the majority of it, I should say, all Michigan families who are eligible for food assistance have been receiving additional monthly payments. The way that this is currently continuing to roll out is that federal approval is necessary every month. And we do not yet have, or at least I haven't seen approval for September, but I'm sure that that's has either happened and I haven't seen it, or it is going to happen. One thing that has been really good about how the system has been functioning is that eligible families and individuals are getting retroactive payments when the issue is the system and are kind of acclimating to these new flexibilities and adaptations. So usually families are able to actually get their full benefit regardless of when the system catches up to them. And one other great thing that happened recently is that college students in Michigan are now eligible for SNAP if they meet certain income and other program requirements. I'm not going to cover them all here, but I can direct membership and guests to some of that information going forward. Next slide. One thing that I I'm always excited to talk about, just because there's some Michigan pride here, is pandemic EBT. Michigan was the first state to roll this out and offer this to our school age students, and even offer it to childcare, even though that part has been a little bit more complicated, and I think we're getting that right now. But pandemic EBT is a program that has been offering supplemental food assistance, similar to SNAP, coming out of a different cost center, but similar to SNAP, and offering that to students who have lost access to meals that they otherwise would have received if school had remained in session. So basically, food assistance benefits that are available during school closure. And of course, the goal of the program is to make sure children do not go hungry. I do not have the numbers for how many students were served statewide during the school year just immediately prior to this one, but I hope to be able to share that soon. One thing I can give my colleagues at MDE credit for is that they've really been telling this story, and I think that it's so important for us to do that. So that's one first kind of note that I want to make about how and what do we advocate for. Let's make sure that we're telling the stories, because the stories are often what moves folks in the right direction and inspires them to continue to support families. The thing I would like to share is that pandemic EBT will continue for the current school year. And I know that the local perspective is following me, and I hope that I am not stepping out and talking about what they wanted to celebrate. But I did want to share that it has been approved for this current school year that we're in, because the approval came down after many schools have started back. Those retroactive payments will be available, as I mentioned earlier. I think that that's the most responsible thing for our governments to do, is to pay retroactive payments. And so that will be an option as well. Eligible schools will have to be at least in some kind of reduced in-person learning. So it ranges from being absolutely closed to some kind of reduced in-person learning of at least 5 consecutive days, as long as that school district that school building has been closed at least those 5, or been reduced for those 5 consecutive days, that eligibility remains. And so we know that we might be in for some instability again in terms of schools being open. And so it's great that schools get their eligibility and keep it. And then students have to be enrolled in a Michigan school that provides the National School Lunch Program or the School Breakfast Program, be participating in a virtual or hybrid school schedule, and of course, and also either be eligible for free or reduced lunch, or like in Detroit, be in a district that's providing universal school meals, or attend a community eligibility provision school. One thing that I will confess, I'm going to make this about me, I have found a little bit more complicated to understand, is how children in childcare facilities or enrolled in childcare become eligible. That has seemed to me to be a little bit more complicated to share. But what I do understand is that children in covered childcare facilities, which for me has been a little bit of a complicated definition, are eligible for pandemic EBT. And that as of December 2020, children under age 6 can be deemed and are deemed to be enrolled in covered childcare facilities, even if there is an actual enrollment or attendance. And what's exciting about that, we can read the policies and get more acclimated to that. But what's exciting about that is that children in those facilities, it's really essential for families with children a range of ages. So both children under age 6 and school age children, and also for those with limited or interrupted access to childcare as a result of this pandemic. And frankly, we know that limited and interrupted access to childcare, quality childcare, was something that was already happening. And that's a continued theme, that COVID-19 has exacerbated challenges for families that they were already having. Next slide, please. I wanted to jump next to, if you go to the next slide, I apologize. I changed the order and I forgot I did, so I apologize to you, Carolyn. I wanted to jump to the community eligibility provision because I mentioned it under pandemic EBT. This is one way the way that this particular provision interacts with eligibility for pandemic EBT is primarily as it relates to childcare that has made more of those benefits available for children under age 6. But really, this is a really important advocacy issue to consider and to think about. CEP, or community eligibility provision, is one of a handful of options that states have to offer universal school meals. So when you hear universal school meals, this just happens to be a form of that. And it allows participating schools to offer free breakfast and lunch or free meals without requiring every family to complete individual applications. And the eligibility for this is a student percentage of 40% or higher free lunch eligibility. So this is not a statewide program. This is something that districts and schools have to be eligible for and have to apply for, plan for. So it is an important and complex decision for a district or a school building to make. But this is, again, one of the handful of options for states to offer universal school meals. And I apologize for complicating this again for you, Carolyn. Can we jump back to the prior slide? So this is another way in which food access is being addressed as a result of COVID-19. This is not a COVID-19 innovation. However, it's really important. It's a way for meals to continue to be provided and reimbursed to the school and the district, but without the district or the school having to establish newly establish and I actually did that wrong. I meant a national summer feeding program. So I apologize for my, I think I used the wrong acronym, but I meant to say summer food service program. So this is just an option to continue offering meals after the end of the school year and through the summer, but without having to establish a formal or standard summer food service program. And as a result, one of the, I guess, challenges is that meals are then reimbursed at a rate that's a little bit lower than summer food service because some of the requirements and other standards are different. Jump too forward, Carolyn, to we should be at CSFP waivers. And thank you for putting up with me on that. Oh, I'm sorry, school meal waivers, I apologize. I'm jumping into these waivers. It's kind of a change in tone, I suppose, but I'm jumping into these waivers just to provide some additional information. And again, I hope I'm not stealing perspective from, I'm told I'm not stealing thunder from the presenter on local perspective. But I wanted to share this just as for folks to put in their thinking caps. Again, we're going to be talking about advocacy opportunities a little bit later. And just thinking about kind of what's best for our youth and our families raising children. And so I'm sharing this mostly just to keep this in, just again, in our thinking caps as we're thinking about what kind of innovations we want to keep going in our state and what other kind of moves might we want to be aware of. What's really important for these waivers is that state programs have to apply for them. These flexibilities are in the school meal situation. These flexibilities apply for the seamless summer option. So I talked about the summer option being a way to continue serving meals through the summer, and these flexibilities extend into that. The part that I wanted to suggest that we keep in our thinking caps is that these waivers are in line, and I don't think coincidentally, with flexibilities some advocates were promoting already pre-pandemic as permanent changes to the standards that were put in place by Healthy, Hungry, Free Kids. And so it's important to just think about, which of these make sense. There perhaps might be a justification for changing the specification on sodium, but what is that? And I'm just pulling that out. I'm not suggesting that there is. These might all be a bad idea to continue. They might be some ways in which these flexibilities can help serve more kids. But I just wanted to put this in front of us just so that we remember that these are waivers that are currently going on, that there are programs applying for them, certainly not statewide, but possibly might be effectively happening statewide. And then we want to think about the fact that there are people that want these types of, I'll say, lower standards, because that's what they are, to remain in place. So we need to just think about how that might affect our programs going forward, especially with eligibility being expanded, which is such a good thing. And then next slide, in the same spirit, I am sharing the CACFP waivers for the same idea. CACFP was fairly recently, standards are fairly recently improved / strengthened. COVID-19 comes around and there's been some waivers to some of those standards. And again, as with the school meal waivers, these are some things that folks have been advocating for as permanent changes to the federal meal patterns after the standards were strengthened. So we just want to think about which of these continue to make sense for Michigan. And then on my last slide, I just wanted to illuminate the fact that the programs that we've talked about and that Dr. Dietz even started to introduce are really those that increase access to healthy food. But we also have to remember that beneficiaries still risk losing access to food periodically and cyclically, and often do. So people often run out of benefits before the end of the month. And so they don't quite have 30 days worth for lots of different reasons. And Dr. Dietz described another example that there was a surge in food security at the beginning of COVID-19. That's also a kind of periodic or a disruption in food security for many families for lots of reasons: loss of their employment, loss of childcare, and having to give up their employment because of that. Not having childcare for school-age students because we didn't need that prior to school closure. And so these are all things that, while we have all these programs and they do exactly what they're intended to, and sometimes more, which is really great, but we have to remember that beneficiaries can still be considered food insecure even while participating in these programs. The other thing I wanted to illuminate is that food insecure individuals can often report decent access or local availability of food. So local availability is not always accessible. So they have access to food. Of course, these school programs provided by schools would not fall in this category, but programs where they're using EBT or SNAP benefits would be. So they're available and they're accessible, if you will. But the high cost means that they run out of benefits before the end of the month. And so what I wanted to just emphasize is I want to characterize these programs as food access programs. I think they have the potential to begin to help us address food security, but to remember that food security goes further. And we're trying to ensure that people do not risk interruptions in their eating patterns or reduce food intake because of these kind of disruptions. So food security should aim at the stability of economic access to food. So I really thank you for the time to speak with you today. I think I failed to leave much more than a minute for questions, but I'm happy to take maybe one.
Okay.
It's Diane, I don't know if it's so much a question as a comment. And first of all, thank you for this presentation. It was very insightful. But then this is a social media comment that I read that some elementary schools are serving the goldfish snacks as the main food entree. Wondering, I think that's appalling, first of all. But how can they get away with that within the guidelines that you shared?
At risk of sounding like I am making an excuse, the only way that something like that can get caught is by it being reported or by chance happening during some kind of a monitoring visit.
Okay.
And I mean, that's just You know, in other words, what I'm saying is that you can do something like that, or let's not even go that extreme. Let's say just leaving one of the items out of a meal, which is really probably quite common. And there have also been some waivers related to interruptions in the supply chain, which Dr. Dietz also kind of alluded to. But these are the kind of things that we really need people to report. We need families to say something when their children report things like that or when they observe them. Frankly, I just think that we need to make it okay for families to advocate for what they need and really encourage. That's, to me, a form of family and parent leadership. That's really the only way we can get those things to change. I don't know if what you're describing was a one-time thing because there was some.
Yeah, it seemed to be within part of as described, it was in an elementary school or more than one elementary school on a fun food day.
Sorry, not to, Lonias, may I say something?
Sure.
So one of the, I think, Lonnie is pointing to the holes in the food lunch requirements. And so I haven't seen this. I used to work in schools directly when I was in Illinois, and the issue of the meal planning and the holes and the not really being as rigid as they should is like they're probably serving whole grain. So in schools, goldfish are whole grains and the kind that you get. And so they're probably using them as their whole grain requirement, which technically actually meets standards when you write it into the meal plan. I've seen this with other things. When I had a school, they would give kids who were vegetarian but needed the protein options 2 yogurts, which was like 3 days worth of sugar. But because the school yogurts do actually meet the protein, and actually it counted, it was not against the rules at all. Actually, they could just serve them 2 yogurts as the main part of their meal to meet the protein requirements because they weren't bringing in a vegetarian meat option, alternative to meat, right? And so in some ways, not sure with the goldfish, sometimes it actually does fit into the the actual lunch requirements, so they're able to put it on a meal plan, but it would not be considered by anyone's standards a healthy lunch or breakfast.
Main entree.
Correct.
Okay, thanks, that's helpful.
But it does fit. They can actually put it in, and it doesn't, it's not against the rules per se. So that's why Lonias, the advocacy is key, because it actually isn't against the rules.
Thank you, Janae. That was an important point to make.
Okay, thank you. Thank you all. So our next presenter is Mr. Matthew Hargis. Before we start that, I just wanted to make a quick announcement. After we come back from instant recess, Lee, our manager of public relations, would like to take a screenshot. So I just wanted to make that announcement. So Matthew, I have your slides up. If it's okay, if I can.
I actually am going to control if that's okay, just so I can roll through some of the slides.
So I'll stop sharing and you can go ahead and share.
Thank you.
So Matthew works at the Office of Nutrition for Detroit Public Schools. We're looking forward to hearing more about what the district's doing.
Sorry, bear with me. All right, can everybody see that okay? Is it working fine?
Yep.
All right, so I actually am tag teaming with my supervisor, Chef Kevin Frank. So he will offer more of the school nutrition department kind of perspective, whereas I have more of the farm to school perspective. And so, I will not be getting into a whole lot of specific data points per se, but I do believe that farm to school is an important tool to help with some of the issues that we've spoken about today, especially food insecurity and, the nutrition and physical activity issues. And so that's just kind of a primer. And so forgive me I kind of repackaged an old PowerPoint, but I've updated it because we're just going crazy with back to school right now. And as the last speaker as the last question was just raised about the goldfish thing, I mean, You know, Kevin would probably tell you better, but it probably technically met requirements, as someone said. So it's really interesting how these things are regulated. But just a little bit about what I'm going to talk about. Like I'm talking about a little bit about the historical context of agriculture and our department. You know, where we are kind of at now, including with COVID, and some of our new short-term and long-term goals, which definitely have been shifted around because of the pandemic. Detroit has such a historical agricultural connection that a lot of people don't realize, starting with the French, taking the ribbon farms as an example. And then interestingly enough, the Ferry Seed Company was based in Detroit in 1895. And that's like a cool graphic that shows their seed catalog. You know, like the Ferrymore Seed Company is the offspring of that, which is kind of cool. A lot of people don't realize. Detroit has, this is old data, but Detroit has thousands and thousands of gardens and farms across the city, which is fantastic. As you can see in the map, like it's fairly distributed, which means that a lot of people live relatively close to these food production centers and can be an important tool for local food insecurity abatement. So again, these are all old data points. You know, we know that Detroit has extreme food insecurity. We know that it's been exacerbated by the pandemic. And, you know, as the last speaker told us, you know, the pandemic EBT has been one way that's been offset. As Dr. Dietz said, you know, with the health outcomes in children, but also in adults, poor health outcomes equals poor health outcomes with COVID in many cases, or other disease. You know, like I like to tell teachers when it comes to plants, like the best way to organically prevent plant diseases and pests is to have healthy, strong plants. And it's the same thing with people. You know, you're more able to deal with those external factors if you're stronger and healthier from the start. And that's a fairly nice example of a school lunch that we had a few years ago when we had Russell Street Deli's black eyed pea soup. And those are our farm grown carrots on that plate. Well, I won't really dive into the educational achievement. You know, we know that students with food insecurity and students that are not as well nourished are going to, you know, underperform in the classroom. Forgot I had a silly little graphic on here. All right, so if you see here, this is the Office of School Nutrition, and we have a large bubble. You know, we feed breakfast, lunch, and dinner. So we're the school food authority. And Kevin, you know, jump right in if you feel like you have anything you want to say. But you know, we are a strong local procurer of foods, up to 35%. A lot of that is dairy and bread, but also a lot of our vegetables, especially now that the 10 cents a meal initiative has been passed to Detroit. So, and we have several farm sites, and School Gardens is a large part of our program. The Fresh Fruit and Vegetable Program, which is another federal program that really seeks to get students just kind of exposed to different healthy snacks.
Right. One thing about the Fresh Fruit and Vegetable Program, though, is that for this year, our the application period is still open, so it hasn't quite been approved yet. The information that you had there was from obviously last year, a couple of years ago. We anticipated coming back into the district sometime mid-October, maybe, but we don't necessarily know exactly how many schools there will be participating just yet.
Thanks for that, Kevin. And I'll just note that, like, we're able to do a lot of the things that we do because we're not a management company. We are in-house within the district. Therefore, we report to our stakeholders. You know, we do this for the children. We don't do this to make a profit. And that's one of the ways that we're able to do the things that we're able to do. Obviously, old data, but it's relatively the same. Although with COVID, a lot of our revenues have been decreased, and I'll talk about that more later. And so for our school garden program, that's a nice example of it. We provide raised beds, soil, compost, seeds, and transplants through Keep Growing Detroit. And we give monthly PDs and collaborative staff support to our school gardens. And I will talk a little bit more about that towards the end as it relates to where we stand now. That's a nice example of one school. They have an outdoor classroom space at Dixon. At Bennett Elementary School had this fantastic garden. And so one of the things that we want to do to help sort of change that school food culture is to really expand our farming and our school gardens, because we know that students that are exposed to farm to school initiatives are more likely to try and adopt more of the healthy food options. And so by this exposure, we're kind of creating that demand for the healthy food options that we're trying to get students to consume. One of the important things that we do is we work with teachers. So we'll host monthly PD opportunities for teachers. They can get their educational credits so they can keep their licenses current. We have a variety of different topics that we cover, and we like to bring them out to our farm so we can do a lot of hands-on work with the teachers, and so that the lessons that they learn can matriculate to their individual classrooms. Another thing, again, is the in-house food production. So we've got Drew Farm, which is kind of our main flagship location. And we grow up to 20,000 pounds of organically grown food for our cafeteria program. However, last year with the pandemic, there was no way for us to put this farm fresh food into the school lunches because it was all grab and go. So most of the food that we grew, we just gave away to families when they came to pick up our, our grab and go meals. So we gave away more than 10,000 pounds of food to families directly through that. This year, it's a little bit of kind of both of what we normally like to do, but also we had to donate some to the community directly because of labor issues, which I will talk a little bit more towards the end. And so we actually did just get a study completed through MSU and University of Michigan. And it was part of our last USDA Farm to School grant. And that study looked at the economic feasibility of our farming operations, A, to see if it's scalable, and B, to kind of look at some of those intrinsic benefits that are hard to quantify to see like if they can offset cost areas. And the results were overwhelmingly positive. It showed that the farming operations are indeed quite profitable when you use Detroit grown produce as the sort of price gauge, which is phenomenal that we're able to show profitability. That helps make the case that we can expand this. And so again, Drew is a school for folks that are cognitively and physically impaired. And that population is especially vulnerable to COVID-19. One of the things that we did a lot last year with the food distribution is that we actually partnered with the transportation department. So we loaded up school buses with meals that we could actually deliver out to the homes of students that were severely disabled, so that we could make sure that their needs were still met in this time. And at the farm, in the cafeteria on the left, a lot of the students will help us out in the kitchen, that they're processing some of the salad we grew that they're going to put on the lunch line. And, they help us out in a lot of different ways. And, it's just trying to, give them some work skills and life skills. And, it's a great kind of opportunity for them. We like to do field trips. That's something else the pandemic has really put a damper on. But we have Food Corps staff members or service members that will put on these field trips. We're still trying to figure out what that looks like right now. We hope we can still do some field trips this year. Last year, we couldn't do any. We dabbled with a virtual field trip format, and we just weren't really satisfied with how that worked. So we're still kind of seeing if we could tweak that and maybe make that something that we could actually do to make it available to all of our schools. But again, it's about that exposure, like all those kids in the picture holding the radishes, like they tried them. I don't know if they liked them or not, but they look very enthusiastic about it. So, you know, getting students to try things and experience things that they've never experienced before is a good way for that retention, and a good way to just kind of help that behavior change. I you know, love when I would take kids on trips out on the farm and I'll just be eating stuff off the plants and they're like, whoa, you can just grab that and eat it. And I'm like, well, you know, you guys got to wash it, but I am comfortable eating it right off the plant. So more importantly too, is the educational initiatives that we provide. So we have 2 strong educational initiatives underneath my scope. And that would be Food Corps, as I mentioned a little bit already, and then SNAP Ed. So we really are getting kind of new into the SNAP Ed scene. It's been a couple years and we're really trying to get our you know, really trying to get into that world. Our goal is to be in 18 schools in the upcoming school year. And this year we were in, with summer school, about 15. And so the SNAP Ed work that we do, you know, is we do the peanut program. So there's physical education and nutrition education, as well as My Garden, which is a summer garden-based curriculum that meets standards. So we have contractors that perform all that work. And there's also a policy systems change component that's we're really working towards and seeing how farm to school can fit into, as well as Food Corps. So Food Corps we've been working with for a very long time now. Food Corps is a very strong educational partner, and we are in 12 schools this year, which is about 11% of the district. So, you know, our impact is growing with both of these programs, and, you know, we're hoping that we can reach more and more young folks to be able to, you know, really have a strong impact on the behavior modification. Something else too, we like to grow some unique stuff, you know, stuff that's not necessarily easy to serve, and stuff that is just really for curiosity's sake. So, you know, we got the beautiful purple cauliflower. On the right is actually rice. We grew rice a few years and kids really got excited to see that. That's Dakota black popcorn down below, and then garlic on the left. And if there's questions, I will get to them at the end. I just noticed a couple chat things. We like to, oh no, we'll go back. So we also like to teach kids about the importance of our small farm friends, right? Like the ecosystem and the environment, right? So we've got praying mantis nymphs that we release with students sometimes on the farm, which is really cool to see them just like get so excited about little tiny praying mantises hopping out of the jar and crawling everywhere. We do ladybugs too. And we also keep bees. So, you know, the bees offer a lot of pollination benefits, and honey is, you know, everyone gets really excited about the honey, which I got to say, Detroit honey it's really incredible. We have a strong youth employment program. Unfortunately, that's another thing that COVID really kind of put the brakes on. So we haven't been able to do it now for 2 summers, but prior to that, we've been doing it for about 3. We actually have a high schooler that went through the program his entire year of high school. Now he's an employee on our farm, and he's going to study agriculture. So it's really awesome. He actually got a full ride opportunity to Florida A&M. So like we're just so proud that that it really stuck with him, and he really wants to pursue this as a career. And that's the hope, that we get more of our youth engaged. Exciting news is that the district, in a collaboration with the DPS Foundation, just got a Michigan Health Endowment Fund grant to plan for the re-implementation of a district-wide horticulture program. So that's something that I'm helping to collaborate on, and very excited to see where we can get with that. We used to do farm stands. Farm stands were great for community outreach, but farm stands are they don't necessarily meet our mission, and I don't want to compete, like as a program, I don't want to compete with farmers that are actually trying to pay bills. Like, we're subsidized by the government. So we've kind of moved out of a farm stand area. You know, we will donate food to the community, but the primary goal is that our food ends up on the cafeteria line. Some other things that have been kind of messed up with COVID is fall festivals and Earth Day festivals. And, you know, I get tickled giving kids hay rides. You can see me there. Like, it's such a great opportunity to get people to come out again, to kind of engage with something that they don't normally get to. We kind of like tried to have that cider mill experience, you know, bring it to the neighborhood so that families don't have to travel. And so it was all a great opportunity for outreach. A couple years ago, we got on the cover of Michigan Agriculture magazine, which was phenomenal. The kids were so excited. You can see that they're, you know, they're enjoying their celebrity status there, much deserved. All right, so like I said, some of the things that had to change. Our short-term goals. Right now, one of the most critical things is we need to stabilize our school garden infrastructure. The school garden program is going on a decade old, which means that a lot of the gardens out there are 6 to 7 to 8 years old, and you might imagine what that means. A lot of infrastructure is decaying. We had plans in place to address this, but COVID has had an impact on our budget, and as a result, those things are all on hold right now. But the school garden program is critical so that every student can experience this at their local school instead of having to go to different sites. So something that's been kicked around is an adopt a garden program. Maybe we can have local businesses, churches, groups, block clubs adopt each school's garden to help with some of that. But beyond the infrastructure, just the upkeep. Without teachers really championing it at each school, upkeep becomes an issue. We want most of the food grown to be in our school meals. And we want to double the number of field trips. We want to look at some certifications. We already started to try to implement GAP certification, which is good agricultural practices. And that's just about safe handling and harvesting procedures. Long-term goals, we want more farm sites. DPSCD has a lot of land, and a lot of land that could really produce a lot of food if we have the right resources and the right momentum. So right now our one farm isn't enough to supplement a whole lot. We grow a lot of food, but it's not enough to really do a whole lot in terms of overall benefit to the district meal operation. It's more just for the educational impact. But we hope that if we can get more sites in operation, that we'll be able to affect that change on a greater level. Like I said a minute ago, we've got the grant with the Michigan Health Endowment Fund to redevelop that district agri-science program. So we're very excited about that. We really want to increase that farm to school assistant program with our students in the summertime. Obviously, this coming year, we just want to get it back, and then, you know, increase it over time. And I really want school gardening to be integrated into the district and a garden at every school. So some of our renewed initiatives, we got Carlos, the amazing corn, and Tammy tomato. So they are our mascots, and we like to do stuff with them. We're still trying to figure all that out. But you know, on the left is like the concept art. On the right is like the real deal. Oh, hang on, sorry about that. School announcements. So we got bike blenders. That's the superintendent, Dr. Vitti, you know, mixing it with some students. And again, that goes into our physical activity and nutrition education. So we had a new school garden design, steel and cedar with a life expectancy of 10 to 15 years. And again, that was in our plans to put this at every school. But it's very expensive and it's kind of on hold right now. Something that's really exciting, Kevin can probably talk more about, but Kevin can talk more about all these things actually. Kevin, you want to talk about these things?
Sure, I'll talk about these ones. So
Kevin, I'm sorry to interrupt, but you have like 2 minutes.
Okay, we're almost done.
Okay, I'll be as quick as possible. So we just prior to COVID, we bought 2 food trucks. The logic behind it was A, marketing, and B, trying to provide a different experience to our students. In addition to those food trucks, we hired 4 new chefs, and we're doing chef demos in our schools where we have, for lack of a better term, we have our chefs doing action stations in our high schools. We also are getting much more into scratch-based cooking. Just to the point of the speaker before who was talking about a lot of schools using very, very highly processed foods. We don't do full scratch being using raw protein, but we do what's called speed scratch or scratch light, if you will, where we take minimally processed proteins and then add add vegetables and add fresh vegetables, things of that nature to make our entrees, as opposed to buying pre-made spaghetti or buying pre-made chili. We buy ground beef and then add everything else to it to make that chili. And in doing that, we can keep all of the artificial colors, artificial flavors out of it, and give our students something that is fresher and more whole than what we would find in other avenues. Excuse me. That's it for that.
All right, we're on the very end here. So I just want to briefly talk about the impact of COVID, right? So the bottom line impacts are we have diminished revenue, and that's because there are lots of other food access programs going on. So families have been less likely to come to schools to pick up lunches. So we've been serving a lot less meals, which relates to decreased revenue, and as a result, a lot of our initiatives are kind of delayed or on hold. And then labor challenges. The labor market's crazy right now, and to be frank, maybe we're not as competitive as the labor market, but also people are afraid, they don't want to come to work. There's a lot of reasons why, but labor challenges are huge for us, and that is it. And I didn't put Kevin's contact, but there's mine, looking like a minion. So feel free to contact me if you'd like to connect further. If there were questions, I'll try to put them in chat. But thank you. That's all I got.
Does anyone have any questions? Thank you so much for that information.
This is Diane, and I have my standard question, which is, are there any short or long-term policies that could be implemented at the state or federal level that would help the Detroit schools move your initiative, which is just outstanding? I suppose I could address that to Lonias also.
So I think from our standpoint, the advent of 10 cents a meal was huge, where I'm actually in the process of finalizing our count from last year, which is going to inform what our endowment, for lack of a better term, will be for this year. So that was a huge help. Being brutally honest, pandemic EBT the pandemic EBT program, while it was a great help, it did kind of make things difficult on us, because while we were doing food distribution, people were coming to us saying, I have a refrigerator full of food and just can't take what you're giving me, because some of our families were getting $5,000 or $6,000 from pandemic EBT, just because of the fact that we have so many children in the same household. Again, that's not a complaint. It just, specifically from our standpoint, that was kind of a negative impact of the program.
Kevin, is the 10 cent a meal a permanent allocation, or does that have to be renewed every year? Do we need to think about constant pressure to maintain that 10 cents?
So I know that it does have to be renewed every year. The overall grant was increased from $2 million last year to $5 million this year. So it appears to be moving in the right direction. I don't necessarily know that there needs to be pressure put to improve or increase right now. Being completely honest with you, I think that it may need to be determined by what happens politically within the next couple of years.
This is Diane. I have one more question. I'm always curious how, because the schools go obviously September through June year, and the growing season is like at the end of the school year through the summer. How do you match that up?
That is the biggest challenge of farm to school. So especially in Michigan. So we have greenhouse production that puts us through the winter. It helps us plant earlier to get crops in the spring, and also later to get crops into the fall. But our main primary strategy to deal with that is to work towards in-house processing, so that we can actually process and freeze and vacuum seal a lot of the farm product in the summertime that can be stored until fall. One of the things we were working towards is to actually get heating for our greenhouses, but that's one of the things that's on hold. The heating would allow us to plant things like tomatoes in February, and that would be harvestable in April, which would be much better for our time frame. A little expensive, but worth the ability to do. But it's a certain challenge.
Basically, funding for infrastructure needs.
And one of the things we did this year in order to mitigate that was to make sure that we planted things that were easily processable and could be freeze dried and held over the break so that we could work it into the menu moving into September and October.
Thanks.
So we are a little bit over. Would you like to do an instant recess, or I'm deferring to my chairs here, or continue?
I think it would be good to take a 1-minute stretch break and then
Okay.
come back, but not delay it, right? Start
Okay.
again in 1 minute.
1 minute. I'm going to put a song on for 1 minute. All right, we might not do any songs, but I will stand up and stretch if anyone wants to stretch with me. Some nice deep breaths. Oh. All right. Okay, I think our minute's up. Our next presenter, let me get back to my screen here. Before we get started, Lee, let me stop sharing. Lee, are you available? And if so, what time do you want us to do this screenshot for you?
Whatever is convenient. I don't want to disrupt the program, but I want to ask everybody to have their cameras on when in their face and view when we take the screenshot. So we can do it now if that works for everyone. Okay. Seeing a couple here who are still, I'm seeing some words.
There we go.
Fantastic. We got one in the middle here.
Alec, are you in the room? Maybe still stretching.
All righty, so if everyone can, again, turn on their camera or even have their picture, that's fine as well. But still have a few. Maybe they are taking a little bit of a break here.
Yeah, somebody just put in the chat, if you want, you can hide the people who are on camera. It's in the settings.
Yeah, but it's a little bit more impressive if I have a lot of pictures of people.
Oh, okay. My screen's full.
Yeah.
Let's have a different screen.
Let's see here.
Yeah, Lee, so in my screen, I only have one person not on camera. Do you want me to take the screenshot?
Nope, I can take it 1 second. Let me just get in here. All right, great. So if I can just have everybody take a look at that little white light for me at the middle and just give me a little smile, that'd be great. 1, 2, 3. All right, 1 moment. Then I'm going to take another. 1 second here. So. Alrighty. And again, if I can have everybody look at that white light right there in the middle of the screen. And 1, 2, 3. Perfect. Thank you so much.
Thank you.
I have what I need.
Wonderful. Okay, so we can get back to our presentation. The next presenter is Christina Peltier, who we know from the Detroit City Parks and Rec. She actually had to step away. So on her behalf, we'll have Hanan presenting on the Joe Lewis Greenway. Hanan, do you have slides that you need to share, or will you? Yes, okay. Then
yes, I do.
Yep.
I was just about to share my screen. Thank you.
Yep.
Here we are. Good morning, everyone. Hope everyone's doing well. I know we can't have a back and forth, but I assume you all mean well. My name is Hanan Yahya. Christina Peltier, who's the lead project manager for the Joe Lewis Greenway, had to step off. But I recently joined the team a couple of months ago as another project manager leading the southwest portion of the Greenway. And prior to this role, I was with Detroit City Council, specifically with Council Member Raquel Castaneda Lopez's office for a few years. So if you know me or have heard my name, it's because of my role with her team. And yeah, I'm excited to be here. Thank you so much for having us. Before I begin, I wanted to shout out a longtime champion who's on this call of the Greenway, Todd Scott. He's been around since the beginning. I've only heard great things, continue to get to know him. So I think it's always important to acknowledge those who've led the way, and we really, stand on their shoulders and of their work as well. So thank you, Todd. Cool. So I want to just kind of go over a few things for those of you who are familiar with the Joe Lewis Greenway, or if maybe it's your first time hearing about it, or you've heard the name but don't know what it's about. So I'll just share some high-level information and updates about what's happening today in terms of construction. So firstly, I'd like to talk a little bit about the project, and I will go to this slide first. So Joe Lewis Greenway, right? It's named after the legendary heavyweight boxing champion, Joe Lewis. And really it's 27.5 miles long loop, full loop that connects multiple cities, multiple neighborhoods across the city of Detroit. So what we do know about the city in terms of mobility is that 46,000 Detroiters do not live within a 10-minute walk of a park or green space, and a quarter of all residents do not have reliable access to a vehicle. So when you talk about health and wellness, overall holistic health of the city, this is an important stat to keep in mind. So the Greenway essentially will be bringing recreational space that will be accessible within a 10-minute walk for 10% of all city residents, which is approximately the same amount of 46,000 Detroiters within their neighborhoods. I want to just step in here and say that right here in this portion is where I grew up and currently live, off of Lonias. So when this project initially, when they were starting to rumble and people started to learn more about it, and prior to my role with this team, I remember my niece had come up to me, I think it was like beginning of the pandemic when we really couldn't do anything and there's really not much to do in our neighborhoods. But she said, "Hey, Auntie, let's go and explore this trail near our house." And I was like, "What are you talking about? There are no trails near our house." She's like, "Yeah, it is. It's like those trails that you take us to on Belle Isle or across the city." And I sort of giggled and I was like, "Nah, you don't know what you're talking about. It must be just a random, place that you go to that, whatever, it's unsafe, whatever." Turns out that the space she was alluding to was the actual site of phase 1 construction, which was an abandoned railroad. And there was a trail that members of the community and folks have access to and used to drive their ATVs. They used to just walk through. It's not the safest, it's not the cleanest, but it existed. And so when I went on a tour, when I first started the job and actually seen it for myself, I was embarrassed. And she told me, I told you so. And I just share that story to indicate that children, people, there's a desire for this type of project, to have access to these trails and to bike. So it's exceptionally important. So what I also wanted to mention, I'll just go back a couple of slides, is that the framework plan is available on the city's website, joelewisgreenway.com. It was published and shared with the public in the spring of 2021, which is when the groundbreaking event took place for the Greenway for phase 1. And essentially it gets into, it goes a deeper dive into the background of the Greenway and the extensive research and analyses of the environmental, social, and economic conditions of these neighborhoods, the data and the strategies that informed the design of the Greenway, and the incredible amount of community input and engagement that we did throughout the entire culmination of the framework plan. So I recommend, if you're curious to learn more and wanna check it out, it's on the website, joelewisgreenway.com. Cool. So right now, where's the Joe Louis Greenway? We have begun construction for phase 1 between Warren here and Joy on the city's west side. And you know, there's a lot of environmental remediation that's taking place right now, a lot of just cleaning up, removing vegetation that's still there. And we should be seeing phase 1 completed sometime next year. But the construction contract was actually approved not too long ago, a couple of weeks ago. So there's a lot of work that you'll be seeing in the next few weeks, and then hopefully into next year as well. At the onset of the phase 1 is going to be a park called the Warren Gateway, is what we're calling it for now. And this is going to be sort of like a trailhead, a destination for neighbors and for bikers, walkers, joggers, everyone to explore and to use. The playground is actually very, very cool. The slide and the climbing wall is going to be the tallest ever built in the Midwest or in the state of Michigan, some crazy stat like that. So it's going to be really exciting. It's going to be wheelchair accessible. There'll be fitness equipment. There's going to be a pavilion, a lot of open green space, parking, bathrooms, really bringing another park into a neighborhood that has been disinvested and forgotten really for a long time. And so very excited to see this park being added to the community. Here are some more photos of the renderings of what this park is going to look like. And this is a rendering of phase 1 between Warren and Joy of what the pathway is going to look like. It's nestled in the backyard of these residential homes. And for this phase, at least for this segment, it's going to be approximately 350 feet wide. So this is probably the largest width of the Greenway across the 27.5 miles of it. It's pretty exciting stuff. And this is another rendering. Cool. So if anyone has any questions, feel free to ask right now. But we're always available to field any questions or comments via email or through our phone number here. And then of course, I will put in my name and information in the chat for anyone who's interested as well. So thank you so much for allowing me the time to be here.
And on that first section that they broke ground for, when is that supposed to be complete?
We don't have any like official dates yet because we kind of we roll with the punches depending on the funding that comes in, but we're expecting sometime in spring or summer 2022. Yeah.
Well, thank you for sharing this information. Are there
Of
any other
course.
questions? Looks like Barbara.
Yep. Hi, Carolyn. Thank you for the presentation. It's so exciting. I wondered, after it's complete, who is it? General Services will be responsible for ongoing maintenance and programming that takes place?
That's an excellent question. I think part of the big ask and challenge is continuously fundraising for the entire Greenway, but then also in the future for a conservancy, a Julius Greenway conservancy that will handle a lot of that work. And so the Detroit Riverfront Conservancy has been very gracious and supportive of the project in terms of funding, and I believe they will be supporting with the development of that conservancy as well.
Thank you.
Mm-hmm.
All right. Can you unshare?
Yes. Okay, thank you.
All right. And I apologize, we're kind of running on time, but our last presentation, I'm really excited to meet this person, virtual to face-to-face. Angela Rogenseus will be giving us some information about the Coalition for Michigan School Children's Right to Play. Oh, and I apologize. That did not happen. So Angela, are you here with us?
I am.
Trying to find your slide. Okay.
Thank you. Let me know if I'm ready to go.
Would you prefer we unshare?
No, you can keep, well, I will share our best practices guide after I give just a brief overview of what we do. So it's totally up to you.
Okay, I'll stop share for now and you can do that when you
Okay. Hello, everyone. My name is Angela Rogenseus, and I work for a group called Ignition Media Group, which is a consulting firm here in Detroit. Prior to joining Ignition Media Group, I was executive director of an organization called Playworks, and I was with them for 8 years. I left Playworks in time is a bit evasive, but I guess May of last year, or I started my transition out of the organization in May of last year. I formally left in September, so almost a year ago. During the time, during the pandemic, we had submitted a grant to our ongoing funder, the Michigan Health Endowment Fund, to form a coalition where Playworks would be the fiduciary and kind of the lead on the coalition, but we would be looking to try to change policy that would require recess and look to make some adjustments around how recess is removed and or whether it's removed as a form of punishment. And so one of the things I saw as executive director of Playworks, which focuses predominantly and partners predominantly with schools in low-income schools across the country, I oversaw Michigan, specifically in Ohio, was that recess was intermittent depending on how many resources you had, the timing changed, what equipment was available varied. I know I'm speaking to a room full of folks who probably are very familiar with some of the challenges of recess in school. And then also recess was often removed as a form of punishment, and it was very subjective. It didn't really matter who, it could be a noon hour aide, it could be a principal, it could be a superintendent, it could be anyone could remove recess simply because of behavior or a child not paying attention and reading or being behind. That most often impacts children with disabilities, kids that experience ADHD and or any type of other attention deficit type disorder, boys specifically, and then boys of color. And so we saw this as an opportunity. I saw this as an opportunity to really test case. Could we potentially look at changing things at a state level to require and make some consistency around how recess is delivered and who gets to have it and for how long. So we were awarded the grant in August of 2020, and I was departing the organization. And so both Playworks and our funder said, you know, as you move into your new role, would you be willing to take this project on since this is kind of your brainchild? So here I am today. So I speak of Playworks as we because I was there for 8 years, and it's difficult for me still to separate myself from the organization because I love it so much. But we have formed a coalition of folks, about 25 to 30 folks, some of which are on this call that help support the work. It is folks in healthcare. It is folks in juvenile justice or represent students around school discipline. And it is also around social emotional learning and kind of those pro-social skills that play helps children develop. And so the coalition is made up of leaders and experts, researchers, physicians, and folks across the board. As we've worked through the coalition, we've identified 2 overarching strategies, and one of which is why I'm here today to kind of share with you a bit about that. One is in order to look at changing policy, we really had to look at a asset-based strategy and a deficit-based strategy. And so asset-based meaning these are good things for kids and we all should be doing them regardless because they're good for kids, whether or not we're required to or not. And then a deficit-based strategy, which is really with data supporting the hypotheses I have around how recess happens across the state of Michigan. So our asset-based strategy is informed and/or we created a best practices guide with the coalition and a variety of subcommittees, which outlines 10 key best practices around recess, play, and social emotional learning. And so I can share it with you. I did not share it out with the broader group because it's still in final draft. It's not in a draft in which I want to share out just yet. But what we're looking for as we go to push this out into the education ecosystem is folks who co-sign or endorse these best practices. And so in its final version, I'm happy to share it with you all. But we would love to have folks' logos and support for these best practices specifically, so that the more folks that are saying these are the best things for children, the more likely educators, teachers, folks in schools will utilize some of these best practices. So I'll stop there for a moment and see if anyone has any questions, or anyone from the coalition who's on here. I see Tiana and Diane. If I've missed anything important, I would encourage you to certainly share. No? Okay. So I will share the best practices and certainly walk through those with you a bit, and then I will certainly answer any questions. So the coalition, as Carolyn said, was the Coalition for Michigan School Children's Right to Play. The best practices guide is around recess, social emotional learning, and play. This is a little bit about the coalition. So our mission really is to ensure that every elementary school student in the state of Michigan has increased access to meaningful recess and play as a part of their school day. And then here is listed all of the coalition members, which I'll give you all just a few moments to look at. I'm sure some of these names are familiar to you all. We have representation from all of the unions, which is really important, the paraprofessionals, teachers, and AFT and MEA. And so our best practices are rooted in evidence and research. And so I will go through those with you. Obviously, we talked a little bit about why play is important, but I don't think I need to go through that with this group here. So the best practice, number 1 is recess should not be removed as a form of punishment. Best practice 2 is recess should occur for a minimum of 20 minutes daily. Many people are surprised that there is no policy or legislation around a requirement that recess even exists in the first place. 3 is play beyond recess should occur for an additional 40 minutes throughout the day to encourage physical activity, including purposeful movement, physical education courses, and after school. There should be no more than 18 kids per adult on the playground during recess. We had originally proposed 35 and our coalition pushed back, even the practitioners, the principals and folks, and said that, that we really should align with the state standard, which says that school agers, quote unquote, are children 4 years and up. For every 18 of them, there should be at least one adult. And so we modified this knowing ultimately that this will be a very big uphill battle for many schools as they lack a lot of resources to be able to ensure that one adult for every 18 kids is even possible on the playground. 5, recess and play should provide opportunities for valuable social emotional learning. We know that pro-social skills are really important and are developed often on the playground. Number 6 is clear rules and community norms should be known by all students and should be utilized to help maximize the time for play. 7 is a safe environment on the playground should be created by implementing safety measures. So a variety of things about injuries on playgrounds, what happens in emergency rooms, and so on and so forth. 8 is recess and play should be held even in inclement weather. It should occur indoors as needed. In my experience, often indoor recess in schools looks like kids playing board games, which, you know, I love myself a good board game, but kids need to move around and we need to be creative in how we get them moving, even in tight spaces. 9, adults and educators should be actively engaged through the duration of the recess, play, and physical activity and/or education. And then 10 is student voice and choice should be honored by giving students the autonomy and leadership to lead peers and select from a variety of games at recess. We believe a minimum of 3 that are inclusive and fair. So beyond the best practices included in this is all of the resources that we've collected through the coalition of what to do as a result of this best practice. So often if you say, please don't remove recess as a form of privilege or as a form of punishment, educators will say, well, then what do you do instead? And so for each best practice, there is a pretty robust set of resources that is hyperlinked in this best practices guide that allows for folks to be able to find resources as they need them to align themselves with these best practices. So what we are looking for, and I will scroll down just a bit more to, these are all of the resources closing, but here is where we are looking for folks to endorse and/or support. And so what we hope to have is a page here that lists all of the, beyond our coalition members who will put their logos on there, are other educational, health, and juvenile youth development organizations that support these 10 best practices as the ways in which schools can execute recess and play and physical activity on a regular basis. And then all of this as a last bit, just to help everyone understand, is all of the terms are defined and most of them come from research as far as their definition. And obviously everything is cited with references. So I will stop there if anyone has any questions about the best practices.
Thanks, Angela. This was excellent. Is there a link for signups? And I would like to encourage all the members of Motion Coalition to endorse this. But is there a link in that document or online that you could share, maybe in the chat, where people could just add their names and organizations?
So I would say the best thing to do at the moment is to email me directly if they're interested, and I can put that in there. But we have a website and folks can sign up. This is just as can sign up to receive updates and when we have calls to actions. But I can put my email in as far as where folks can email me to sign up and/or lend their name to the best practices. I will share it out with this group as well. I'll give it to Carolyn once it's in final draft form so that you all can then review it in more detail with whatever stakeholders you have to make a decision on whether or not it's something to consider. And my email is in the chat. And then the website for the coalition, I also am putting in the chat now, which you can sign up for, which is again, where we'll have all our call to action, share out new information, things like that as the coalition progresses. We're hoping in the next iteration to share the deficit-based strategy, which we have a call at 12 o'clock with some of our policy folks and our survey designers, as we're doing a statewide survey to collect data to support this thesis. That recess doesn't happen all the time and it's varied. And we will use that data to hire a lobbyist, which will not be funded by our grant, will be funded by private funds, to try and move legislation at the state level to make this a reality for our kids and to make sure that every child has the opportunity to play safely every day at school, and that there's some safeguards or guardrails around ensuring that that happens.
All right, thank you, Angela. So on the agenda now, we're scheduled to discuss ways to advocate. I don't think I need to share my screen for that piece, but Dr. Dietz, do you want to take the lead? Maybe I should.
Well, I think the presentation we've just heard offers an important opportunity. I think we, and the whole area of obesity, physical activity is one of the areas that I think is most neglected. So yes, getting on board with that initiative is important. I think sustaining the efforts around school gardens and local produce production is an important step forward. One of the things that I've recently been thinking about is that we put a lot of emphasis on fresh, but I think we neglect frozen. And I don't think we know enough about the cold chain around frozen products. But I think as I thought about the lockdown and the food supply chain for fresh, frozen became much more of an attractive option. I think long term we need to think about perhaps how to begin to implement that, because that is an option potentially for corner stores. Although, as I said, I think that we need to be sure that frozen doesn't undergo a bunch of freeze-thaw cycles, which would make the frozen less acceptable. But Diane?
I agree with those. I'm interested if any of the presenters are still on the call, if they have any specific policy initiatives they would like to support. I'm especially interested in the, I guess, the Detroit school program, in terms of, are there potential funding opportunities? I guess I'm hearing more of an infrastructure piece, and I don't know if that's the right word, but to help to support the building of some of the hoops and some of the other materials that are needed to preserve the food, I guess, and extend the growing season. I don't know if those folks are on the call still, but that may be, if they're not, something we could follow up with. I think, again, there's grant opportunities and other opportunities, I think, that may be coming through with some of the expanded federal money that may be coming through under the new infrastructure bill that we could take a close look at.
Yeah, Diane, that's definitely true. I think you hit the nail on the head. That a lot of it is the infrastructure that we need support with. I mean, but also, an internal issue is that we need more staff, to be able to execute. We need staff to be those role models in the school gardens. We need staff to take care of our operations and to process, more importantly, because right now my farmers are also our processors and we can't do both. But, I think part of that is, about equitable wages and all of those conversations.
Yeah, we may want to have a follow-up conversation before our next meeting and have some of the committee members who are most interested in this issue have a conversation with you about that.
That'd be great.
Would you like to do let me share my screen. All right. I apologize, we are kind of low on time. Do you want to continue this discussion or should we include the legislative updates?
Does anybody else have any ideas on the policy end before we move to the legislative updates?
I think only to say that this whole advocacy issue is a little off-putting for people that don't have any experience in it, but it's a really important step to contact your council member or your legislator. And it's important to recognize that may make a difference. That I mean, we saw this in the recent elections about how few votes it took to make a difference between somebody winning and somebody losing. That's as true at the local level as it is at the state or federal level. And I think on this group in motion has been, I think, particularly effective in identifying areas to work on. But as I look at the screen, I see a lot of advocates already. So I'm not sure that ways to advocate needs further discussion.
And I should just mention, and Dennis may want to reiterate this, is that we were very much a part of the push to get the 10 cents a meal program expanded. So, I think we should all pat ourselves on the back for that piece.
The plate campaign.
Plate campaign. Most fun I ever had at work.
Okay, Dennis.
Well, I'll be very brief because we have our legislative consultant, Sarah Hubbard. She is principal of the QAS, provides our support on the formal side of advocacy lancing, and she has a report for us today. So I'll step back.
Thanks, Dennis, and hello, everybody. Sarah Hubbard from Acuitas. Great to see you all. I'll be brief since I know we have a couple coming on, but I just want to give a quick general budget update of where the legislature is right now. We are still in the process of negotiating the fiscal 22 budget between the legislature and the governor. We hope that they will get that completed next week. The legislature is expected to send the governor the fiscal year 22 budget probably on Tuesday or Wednesday. And then some of them will be going to Mackinac for the Detroit Regional Chamber Conference next week. That budget, though, won't be spending all the money we have available to spend. What we do expect the legislature to do after that is to move into talking about how to fund the American Rescue Plan Act funds, how to spend those, and then how to spend additional general fund revenues the state is receiving this year due to increased tax returns. So it'll be a very active session till the end of the year, particularly around spending and budgetary items. And so, certainly opportunities for many of you, if you aren't already pursuing funding from the state for your programs and projects, it may be something to think about. But specifically, I just wanted to identify a couple things. The one piece of the budget was already completed and sent to the governor earlier this year, and that was the K-12 school budget. And I know there are a number of things in there this group likes to keep a close eye on. That budget does maintain appropriations for the Michigan Fitness Foundation to continue to work with the Department of Ed to invest in physical education curriculum. There's $400,000 included in that. Does increase the 10 cents a meal program you just referenced by 2.5 million, so that there's 4.5 million total for support of local produce and school meals. And I think you're familiar with that program. It increased almost $700,000 for school lunches and 7.4 million for school breakfasts. Also some before and after school programs. The House proposed 5 million for those. They weren't in the final budget, but possible that that'll come up in the supplemental later this year. And then a variety of federal funds that have come through for summer enrichment programs. So a lot of activity there in the K-12 budget. And then, as going forward for the current year. And I know you're asking for other issues the group might consider supporting. A couple things I wanted to put before you to consider at a real high level. Recently, Senate Bill 614 was introduced before the legislature by Senator Michael McDonald. That bill would create a licensure program for nutritionists and dietitians, in particular for the application of medical nutrition therapy. We do expect that bill to move forward. It was bipartisan in its nature. And I know given the group's interest in nutrition, healthy food, this might be something to kind of bolster your efforts in support generally of safety and public safety around nutrition. We do expect the Michigan Health and Hospital Association to support the bill. The Michigan Academy of Nutrition and Dietitians or Dietetics is supporting it. And we expect Henry Ford Health System to support it as well. Diane, you may have taken a look at this already. That's word we got back. So that's out there. And another bill that was recently introduced, I'm not sure if it'll go forward, but I wanted to flag it for you. House Bill 5283, introduced by first-term State Representative Julie Rogers out of Kalamazoo, a Democrat out of Kalamazoo. That would create an environmental literacy task force that would come up with an environmental literacy model curriculum for schools. And that effort, that task force would have included in their things that they need to contemplate is something that would contribute to students' healthy lifestyles by making outdoor experiences part of the regular school curriculum and creating programs that promote healthy lifestyles through outdoor recreation and proper nutrition. So that kind of dovetails with Angela's work and the legislation she's looking at doing. This is a little different approach than what she's talking about, but similar in spirit as far as that goes. And then we have a written report for you as well. I don't know, Dennis, if you were going to distribute this or not, that does speak to all those things I just covered, and then also highlights a program that Blue Cross has put out there, teaming up with leading health and wellness organizations as far as some funding for schools that's currently being accepted for building healthy communities. And then the last thing I wanted to mention, something that just came out since we've been on this call actually, is the governor announced a proposal for Michigan Healthy Communities seeking to spend $1.4 billion of the ARPA funds to expand care for families, build up facilities, and invest in local public health. So she's been doing a series of announcements on how she would propose to spend all the federal money that's coming in. These announcements are largely directed at the legislature to give them an idea of how she would shape expenditures of that money. They'll be, as I mentioned earlier, they'll be starting to have more formal conversations about that, I think, in the next couple of weeks. But this particular announcement would do things like investing in capacity for community-based behavioral health and substance use disorder treatments, investing in telemedicine infrastructure, investing in the new state psychiatric facility in Southeast Michigan, et cetera. So things like that. And I will share this, if I didn't already, with Dennis in the event that you want to share that with the coalition, Dennis. Any questions? Questions, complaints, thoughts, or ideas?
Well, it's wild to be in this position with the surplus during these times. I mean, so, yeah.
It is. You know, the governor and the legislature find themselves needing a process to figure out how to spend all this money and wanting to do it in a way that it gets, to the end recipients quickly and without, any shrinkage in that money or any fraud or abuse, right? So they are being deliberate in their approach. I think the governor would prefer that the legislature appropriate it sooner than later, but the legislature is, using this opportunity as a way to stay at the table with the governor regarding all of these expenditures.
I had one question if I could jump in. What is the avenue for pitching ideas for how to allocate this funding? Because, Detroit used to have an open streets event every year where people were outside and supporting local businesses. And it seems like that would be a great way to support these businesses as they come back from the pandemic and get more people outside and exercising, but hasn't been funding for that. I'm wondering how we might make that suggestion.
Sure. Todd, I'd be happy to talk to you offline more about that too, if you want to connect, to give you more direction. I know that time is running short, but in general, we typically start with the governor's office and the legislators that represent the area that the spending would take place initially. So if it's, the project you're referencing, of course, those legislators there, but also it's critical to talk to the members of the Appropriations Committee in both the House and Senate, the State Budget Office, and others that would be affected. And really, it frequently takes, a series of meetings and opportunities to convince them, to spend their money on these kinds of projects. But again, I'd be happy to talk to you more offline if you want to connect with me, or if you want to put your email in the chat or whatever, I'll put mine in there.
Quick question, Sarah. Has there been any discussion about funding produce prescription programs?
Produce prescription programs, that doesn't come to mind immediately. That I'm aware of. It's possible that it's out there and I just haven't seen it, but it's not something I'm aware of.
Okay. And they have to pass this, like they're all not going to Mackinac because they have to pass the budget by the end of September, or?
Yep, so the budget is definitely due by the end of September. We expect the legislature to actually pass the budget on Tuesday so that they can go to Mackinac on Wednesday and at least participate in part of that. You may have heard about some of the controversy related to the event this year. They are requiring vaccinations for anybody who's registered for the conference. And there are some legislators that just don't want to comply with that requirement, or at least don't want to share that information. It's still yet to be determined, I think, what kind of participation we see from the legislature. On the other hand, I know there are a lot of them that are interested in planning to attend. So, it's going to be different in a lot of ways this fall. I expect that the chamber conference will be back to kind of normal operations when it happens at its regular time again next spring.
All right, thank you for that update, Sarah. I think we're at the end of our meeting. This is our roundtable time. I'm going to unshare so we can see each other.
Carolyn?
Yes.
I was going to give a quick update on the transportation bill.
Yes,
Is
yes,
there
I'm
still
sorry.
time for that?
Yeah.
Okay, so there's been a lot happening in DC, which you may have read about infrastructure stimulus and then a renewal of the transportation bill. And it's 2,700 pages long, the Senate version, so I'm not going to go through all that, but the House passed a very progressive bill that really had more emphasis on transit and greenhouse gas emissions. The Senate had a more modest bill because they wanted to maintain bipartisan support. And it looks like the Senate's going to force the House to go along mainly with the Senate bill in order to maintain that bipartisan support. But it does include some very good things for what we're interested in. There's going to be a 70% increase in grant funding for biking and walking projects. In terms of safety, the state of Michigan is going to be forced to spend 15% of their safety funding on bicycle and pedestrian improvements. And I just looked, and currently it's like they spend 1.9%, even though 20% of all fatalities are bicyclists and walkers. Includes money for building complete streets. It forces the state to do a complete street standards guides. It does some improvements to vehicle safety standards, including headlights. The headlight regulations haven't been updated since 1969. And we know that a lot of the pedestrian and bike crashes occur at night, where motorists often say they can't see pedestrians and bikes. It also includes Connecting America's Active Transportation System grant program, which will be, $500 million a year for competitive grants for major trail projects such as the Joe Louis Greenway. There's $5 billion in the bill for connecting communities, which would take out expressways, especially in urban areas. And for example, the I-375 project could be a recipient of grant funding from that. There's a new program called Healthy Streets, which will improve tree canopy and green stormwater infrastructure. That's $100 million a year, and that's targeted would be targeted in areas with high poverty. And one of the bad things is that the House version included member designated projects, which are like earmarks. And there was a $3.9 million project in there for the Joe Louis Greenway and $1.8 million for the Riverwalk. And since those were in the House bill, those aren't included in the Senate bill and likely won't be. So those may have to be passed through other legislation. And as I mentioned, that unfortunately that Senate bill is not as strong on climate change and transit, but they're trying to see what they can do to make some changes to it, to make it a little bit better than what it is. But it's still being worked out between the House and the Senate right now. That's it.
Thanks, Todd. Diane, Dr. Dietz?
I don't know, did we want to do the roundtable? Do we have
Yes.
time for member updates? Just open it up to the group.
Hi, this is Kim from the LAHC. I just wanted to say that we have a couple of fitness events coming up to promote physical activity. So I will throw the flyers in the chat box. But if you guys could share those out, that would be awesome.
Great, thank you. Anyone else? Everyone's very quiet this morning. Carolyn, do we want to mention, I don't see it on the agenda, but I'm going to throw it out there since we have a minute. Are you putting together a group to think through the annual symposium? Should we start thinking about that and looking for volunteers to participate on that?
Yes, Diane, I was actually going to text you that just a minute ago.
Read your mind.
You read my mind. Yeah, so if anyone's interested, we will have a symposium in the spring, and we're hoping it will be in person, and we're really excited to hopefully have a nice event where we can all collaborate and work off each other. If there's anyone in the room that's interested in volunteering, it will be in April. So we're looking for people to start volunteering now if you're interested in helping to plan that event. So the annual summit planning committee is open.
Thank you.
And also, if you have any ideas for the summit that you'd like to share out, please feel free to share them with Shelley and myself. Oh, and Ashley from Black Mothers Breastfeeding Group just shared in the chat that there's the breastfeeding conference, yay, coming up in October. So we'll share that information out for you, Ashley. And then Kim, I will send your file out as well. Sorry, I've got all these private messages.
Thank you.
All right, any final thoughts?
No, I just want to thank everyone for participating again in our video meeting. I think we get really good attendance through this way, but it do miss seeing people in person. And I want to thank all the presenters too. These were an excellent series of presentations, and I think very informative in terms of where we can go on some policy and advocacy work.
Right, I agree. Thank you to all the presenters. This was a really informative 2 hours, so thank you, and we'll look forward to working on issues with you.
And our next meeting is, Carolyn, just to put that on people's.
Yep, next meeting is November 16th at 10 a.m. and I have that here. All right.
Perfect, thank you.
So yes, please join us for our next meeting on November 16th.
Okay, bye everyone. Thank you.
Thanks everyone.
Bye-bye.
Bye, thank you.